All right, I'm going to show you guys my signature hair wrap that I do for cranial surgeries. This is my medical student, Madison, who's going to be my volunteer. So when we do craniotomy, of course, the patient has some of their hair shaved and a dressing on top. So one of the things we do right after surgery, obviously, is to wrap their head so the incision stays clean and there's a dressing on it and stuff to absorb any blood or any fluid on it. I use 2 Curlexes. Finish it off with how I tie it into my signature bow that I mentioned in the other video. The patient is obviously asleep during this part, so I start with the Curlex on one side, opposite side with the second Curlex, and I come across with both. I can tuck away any gauze, and then as I'm wrapping it around, I can kind of compress or pull on the 2, which will give a little bit of compression, which will help with swelling after surgery. Make it look good along the way, I promise. All right, close your eyes. There we go. All right, there we go. Good thing the patient's asleep during this part.
They only see the end result.
So that's right, that's right. But I always make sure it's under the occiput or the back part of the head so it won't slide off, because one of the things that happens with some of these head wraps is as soon as they get to recovery room, it slides off. So as I come around and around, I just tighten it, and then once I'm done and it's looking how I like it, I come off to the side like this, 2 clean dressings. I tie it, then scissor, cut it, then little bow. So it's cute. Ta-da!
Ta-da.
There you go. You look beautiful.
It's very cute.
You can't really pull this thing off. It's hard to get off. So the only way to get it off is by cutting it and then unwrapping it. Boom! Ta-da!